And of course, part of that is about patients having a sense of shared decision-making in their care. And can I invite Neil Bacon now to explain how he and his colleagues are turning information and transparency into improvements for patients?
Thank you very much. Thank you for the opportunity to share my purpose, passion and work that we do with you. It is driven by a vision that all those receiving healthcare in this country should have an absolutely excellent experience. Not just good, but truly excellent, whoever they are and wherever they receive their care. Like the Secretary of State, and I suspect everybody in this hall, I believe that large parts of the NHS are truly excellent, incredible. Great people delivering great care day in, day out. But as a doctor who has worked in the NHS for nearly 20 years, I'm also aware that some parts are not good. And there is often a large gap between the best and the worst care. Many doctors and healthcare professionals are aware of this real variation, but most of the public is unaware that their outcomes, the results of their operations, the quality of their life is critically dependent on who they choose for their care and where they choose to get that care. The evidence is clear. There is significant variation, and choice really does matter. I'd like to share the story of just one patient, the 9-year-old daughter of a friend. A previously healthy child, she'd become increasingly unwell, unable to take part in the school sports she loved. Unfortunately, the family weren't getting far with their doctor, who after a number of months thought it must be asthma and was preparing to transfer or get an opinion from the local hospital. The family asked what I thought, and I could tell from the symptoms that this child needed expert care, and that, as it happened, I knew the best person for her to see was in a hospital 40 miles away, not their nearest hospital. Thanks to the NHS, she saw one of Europe's leading paediatric gastroenterologists, who rapidly diagnosed and treated a serious intestinal problem. She was soon back to full health, within 6 months winning a national cross-country title. Her eventual care is an example of how great the NHS can be. But what about those who don't have a medical friend who can help them? People who don't know how to choose the best care? And how can we close the gap between the best and the worst organisations, reducing the variation that affects patients every day and that costs hundreds of millions of pounds? The Secretary of State has made it clear that an important answer to these questions is ensuring real, true transparency in outcomes and patient experience, making sure that the hospitals, the doctors, the nurses, and most importantly, the patients really can see and understand which hospitals are best and which are trying to improve, which GP practices get the very best outcomes for their patients, and thereby giving the public real choice. Such transparency drives improvement, delivers cost-effective care, and saves lives. However, we will still hear resistance from groups that will argue against such transparency and such openness. They will claim the data is inadequate or that patients don't want choice. It is absolutely vital that comparative information on outcomes, safety, and patient experience is published in ways that are understood and useful for patients if the NHS is to improve. As a doctor, I'd like to applaud the powerful work that the Secretary of State has already done in ensuring such openness is at the very centre of the improvements to the NHS. It is through his vision that infection rates for all NHS hospitals have been published weekly since the middle of last year, something that had never been achieved before. And we've already seen the impact of this work in the form of continued falls in rates of MRSA and Clostridium difficile. And that translates into massive health benefits for patients whose hospital stays are not being blighted by these terrible infections. building on these real benefits and the progress already achieved by the Secretary of State's transparency drive requires that it be complemented by a similarly innovative, bold approach that harnesses the experience of patients and then shares that openly and transparently. We know that those organisations that deliver an excellent experience, whose patients feel confident, informed and safe, those are the organisations that deliver the best outcomes in the most cost-effective way. Capturing such patient feedback, ratings and reviews in a robust manner and then making it fully available to others is the business of myself and colleagues at I Want Great Care. We're working with NHS organisations to help drive a continuous improvement in the experience of their patients, whilst enabling the public to read detailed assessments of doctors and hospitals that have been provided by thousands and thousands of patients across the country. But it's not just about giving people the information they need, it's also about making sure the public know that their opinion and experience, their feedback and the ratings of the care is fundamental to improving the NHS. Making outcomes and patient experience transparently available is the key to great care and enabling choice. We should all recognise and be proud of the pioneering work that the Secretary of State is doing to make this a reality. Thank you.
Thank you very much. Thank you. Personally, I'm very grateful to you for what you said, because I do think, as you put it, I Want Great Care is what it's all about, and empowering patients and indeed energising doctors and nurses by the publishing of information. That transparency, I think, is already demonstrating it can really deliver for patients, so thank you.